Let's now shift our attention over to Russia. Let's now first have a look at the COVID-19 situation in the country. More than 221,000 people have now been tested positive for the novel coronavirus in the country. 2,009 people have lost their lives already amidst the rising number of positive coronavirus cases. Russian President Vladimir Putin has announced relaxation in lockdown restrictions. The non-working period imposed to limit the spread of this virus will be lifted from Tuesday, which is today. The announcement comes on the day when Russia reported more than 11,000 new coronavirus cases in just 24 hours. Putin justified his decision to open the Russian economy by saying that the country used self-isolation period to prepare its healthcare system. He also said that bringing economy back to normal is in the interest of all.
Starting from tomorrow, 12th May, the national period of non-working days will be over in all the country and for all sectors of the economy. But the fight against the epidemic is not over. Its danger remains.
Now, let's have a closer look at the coronavirus outbreak in Russia. It's the fourth worst affected country after the US, Spain and UK, as you can see on this chart. Since May 3rd, Russia has recorded more than 10,000 positive coronavirus cases each day. In the last 8 days itself, the country has reported 85,634 positive COVID-19 cases. Now, despite worsening situation, people in Russia are expected to end the self-isolation period and show up to work today. In his televised address to the nation, Putin earlier said that lockdown measures will be tailored according to the local needs. And earlier we were joined in by Russian affairs expert Fred Weir from Moscow, who explained sudden super surge in the number of cases in Russia and also his assessment of the move by Vladimir Putin to lift this lockdown. Let's listen in to his take on the news story.
I think it's pure mathematics. I think we knew this was coming, and I think that we're far from the plateau, or whatever they call it, here in Russia. They're also ramping up testing, so you get a lot more, just confirmed cases than ever. But it's clearly still a prevalent infection, and there's probably, the mayor of Moscow himself said that there are probably many multiples of infected people out there beyond what we have reported so far. So it's on the upward swing. There is no doubt about that. He's taking a bit of a gamble, but he's probably also taking a lot of advice from his scientific medical establishment. He's also probably getting it from the business end as well. The Russian economy can't afford to be locked down for all that much longer. But his arguments made sense. We'll just have to see whether he turns out to be right in the long run. But he did say they have ramped up the number of hospital beds. At the beginning of the crisis, it was about 30,000, and now it's 130,000 available for COVID-19 patients. They have not seen the surge of critical cases that has happened in the West, that has happened in places like the US and Italy. In fact, the Russian death rate of confirmed cases remains remarkably low. And therefore, that was the main reason for lockdowns everywhere, to avoid the surge, the intense pressure on medical systems that might overwhelm them. He says we've dodged that bullet. Now, the medical system is capable of handling even these increased numbers, especially since there are fewer of them that go critical and result in death than in many other places. That's what he says, and I guess we just have to wait for it. I also should add that he didn't say the lockdown is completely over. He said there will be a phased relaxation. And in a place like Moscow, which is the epicenter of this outbreak, most of the measures will remain in place. Everybody has to wear a mask and gloves, has to have a permit to go out into the street, even to work. Most things like restaurants and cinemas and so on will remain closed for the foreseeable future. So it's not all at once, and it's region dependent on what the conditions are in each region. There will be different regimes.